So moving to the next uterine condition which we'll be discussing. This is what is known as dysfunctional uterine bleeding. Dysfunctional uterine bleeding. Right? So for this dysfunctional uterine bleeding, it just refers to abnormal uterine bleeding. Alright? Without any identifiable structural or medical cause. Do you understand? So the thing is, the cause is not clearly known, right? Or probably before you can know the cause, you have to do a lot of digging, just to discover what is causing the bleeding from the uterus. All right. So it's often linked to hormonal imbalances, especially if estrogen and progesterone levels are not balanced. That's one of the most common causes. So it's considered a diagnosis of exclusion. Do you understand? If there's bleeding from the uterus and you can't find a cause, you can just call it dysfunctional uterine bleeding. Do you understand? So if you look for a cause, so other things must be ruled out and not exist first before you say it's dysfunctional uterine bleeding. So what it looks like. So the woman is bleeding outside her normal menstruation period. Alright? And probably when she's menstruating, the periods are so heavy, like it all joins together, so it's so heavy. Irregular periods, her periods can be too frequent or too far apart. She's spotting between periods. Sometimes not really bleeding, but some 1 or 2 blood clots on her pants outside her periods, right? Then she has hit menopause, but she's still bleeding. You understand? All of this is the possible ways in which dysfunctional uterine bleeding could actually look like. Then for the common causes, we have things like polycystic ovarian syndrome, right? That's hormonal imbalance, thyroid disorders, perimenopause, puberty. Okay. Then sometimes it's side effects of some drugs. Maybe she's taking like birth control pills, anticoagulants, hormone therapy, right? Then medical conditions like she has endometriosis, she has fibroids, she has polyps, right? Bleeding disorders, right? So about the lifestyle factors, maybe she's stressed, weight changes, excessive exercise. So how about the diagnosis? You could actually want to do some 1 or 2 imagings like ultrasound in the pelvic, right? Hormone tests just to know the levels of some hormones in the body, important hormones, estrogen, follicle stimulating hormone, luteinizing hormone, thyroid hormone, right? So endometrial biopsy, this one you are doing it most of the times if the woman is above 35 or she has passed menopause. So you are doing it because you are so much suspecting that maybe it's a cancer, right? Then pregnancy test to rule out pregnancy. So these are all the possible treatment options you might actually want to employ. So hormonal therapies, non-hormonal medications like NSAIDs to deal with anything inflammation, cervicitis, vaginitis, salpingitis. Then ovulation inducing drugs. Then surgical options, right? Hysteroscopy, hysterectomy, dilation and curettage, and all of that. Then if she has lost so much blood that you are suspecting anemia, they have to now replace iron. Okay.